In Seattle. My name is Ann Redder, and I'm head of chapter of Products That Counts in Seattle. And my day job, I also have a company of my own, Minds Band. But I want to tell you, Products That Counts, this is about our fourth event, Products That Counts. And what we're doing is we're building a community of product executives or product managers. And so we work with product executives across the Puget Sound to share their unique viewpoint. So we're really excited by the presenter we have tonight, and we have next month's presenter as well. So thanks for being here, and I also want to say thank you to our sponsors. So I'd like to thank Amplitude. They're a product analysis platform. We also have mParticle, if you're interested in them, a data platform for growth marketing, and so we have mParticle here. So if you'd like to speak to her, thank you very much. And then also, Nate, do you want to say something about Zillow? Thank you very much for a really nice meal and great venue.
Thank you. Thank you for coming. Welcome to Zillow headquarters. We're glad you're here. We're hiring, and if you're ever interested in a job, please come speak to me or Joe, recruiter in the back. We're happy to be here, and we're happy to sponsor. We love Products That Count, and we're really excited about the speakers that come in. So thank you.
Great, thank you. The picture you see up on the screen is definitely not me. It's SC Modi. She is in San Francisco, and SC is the woman who created Products That Counts a few years ago, and she had a couple great experiences at Facebook and Twilio, and then she realized that she wanted to share a little bit about product and community, but more so grow community so you can understand what goes into a product that counts as well. And she's really dynamic, and if you have a chance to see SC in person, I highly recommend it. But I'd like to just keep us on track, so I'd like to introduce Daniela Luzi Tudor, who's here this evening. I don't know if many of you have had a chance to read any of the press, but you've been in quite a few things, Wired, Seattle Times, Forbes, and then I watched the YouTube also by the Surgeon General, so all of that's really impressive. And I just love your story, and I love the fact that you're talking about how you can use technology to heal and bring people back to a wholeness and well-being. So take it away.
Thank you so much, Anne. I'm very excited to be here. So I'm the CEO and founder of WEconnect Recovery. I'm also in long-term recovery from drug and alcohol addiction, and actually I'll have 4 years this month. And thank you. And the genesis for our company really started with my own experience. So before this, I had a startup in music technology space in Los Angeles, and I moved back to Seattle after my business partner for that, who is my best friend today. She helped me realize that I needed to get help. And so I came back to Seattle. And being originally from Europe, my parents and I had no concept of what therapy might be, what counseling might be, or addiction recovery. And so for 18 months, I tried to stop on my own. And after that period of time, I opted to go into inpatient treatment. And so it was in inpatient treatment that I discovered a few things. One, that after you're in inpatient treatment for 28 days, you get a piece of paper at the end, and it says all the things you're supposed to do every single day for the rest of your life to stay in recovery. That can include anywhere from going to 12-step meetings, doctor appointments, changing your exercise patterns, your nutrition, and meeting with therapists or other kinds of counselors on a regular basis. So I thought, no wonder that the relapse rate is 80% if all you're getting at the end of treatment is a piece of paper to walk out. So that was the genesis for the product. And at that time, having just an idea, we went ahead and we interviewed 200 people in recovery. We looked at peer-reviewed research broadly. I don't have an academic background in terms of research, so we looked at some research, but also interviewed professionals in the space. And we thought, we're in recovery, the core group that started the company, and so we're going to build the first patient-facing application that would help people that would help people get into recovery. And so what we found out about the treatment space was quite shocking. One, that out of every 100 addicts, 10 will enter into inpatient treatment and only 2 will stay sober. So those are pretty bad odds, considering that addiction is the largest public health epidemic of our time right now. Furthermore, we found out that the systems were also broken. So currently in treatment centers without technology like ours, the communication is broken between the insurance company, the treatment provider, the families, everything. A lot of the things are still done on paper, or they're using really archaic EMR systems. On top of that, what we found out too is that when somebody gets into recovery, the treatment center will usually make a phone call to the patient once a year, ask them if they're still sober, and they'll consider that a successful outcome. So there was really non-existing data at the time when we came into the market. So we had 2 things we really wanted to impact. 1, the verified outcomes data, and 2, the relapse rates. And so we looked into why does relapse happen? Well, there's several reasons. 1, there's a lack of accountability to those treatment plan activities. 2, there's a lack of instant connection with their community support. And there's old environments and triggers. Typically, people go back to their old environment where they were at that time. And so we built the first app based on our own personal experiences, and being a small, scrappy team, we thought we were building exactly what the customer wanted. So that was lesson number 1. We went out into the market and we built this patient-facing application. We looked at some digital healthcare studies in terms of colors, in terms of the design with our junior designer that we brought on board. And we created this app that helps you track all of your treatment plan activities. And in return, we use research on contingency management, which is really about giving vouchers and rewards for keeping on track with those treatment plan activities. The app also does location verification, so we were able to actually verify that the person attended their treatment plan activities and also for how long they were there. So this was the first time that we could actually collect appropriate data and then connect them to their community on the app so that a family member or a clinician could instantly intervene before the brain actually went into a relapse mode and went back out. So we did have quite a bit of success, and so we built our next product, which was the data dashboard. Now, this was a true proof of concept. As you can see, it's super bare, but what it did is in a color-coded way, it would show the clinician if an individual went to their meetings, if they did their morning meditation, went to their doctor appointments, all those kinds of things. The other challenge that we found with building the first one is that not everybody has a smartphone, especially when you're getting into recovery. Often people are homeless. And so we created a partnership with a major carrier to provide not just the app to people, but really provide a smartphone and educate them on how to use a smartphone for the first time. During our pilot phase, we worked with an economically disadvantaged population down in Arizona, and we taught people how to actually use a smartphone for the very first time on top of utilizing our app. So that was an added challenge that actually, if we really want to be a social impact corporation, that we have to be able to make this accessible to everybody. And we also had some partners. So we brought on a strategic treatment center partner to give us feedback. And also one of our investors is the CEO of MetaLab. MetaLab is a product design firm that worked with us in partnership. They've created UI UX for companies like Uber and Slack and other big companies. And we also worked with another contracting company, Substantial, in addition to our in-house team. And we found that actually really valuable. So with all of that, we had some success. We started signing contracts, but we missed the mark on a couple things. One, the perceived benefits of using the app aren't immediately understood. It turned out the way that we built the app originally had a lot of text in it. It was hard to find certain sections. And so that became one of the major challenges, especially when someone is 28 days sober. You're not functioning quite at the level that a normal customer might do. So the other piece was that checking into a routine felt like a chore. We didn't use any kind of evidence-based gamification components, and so people actually had to go into the app, check into the routine, and ultimately that was something that we really had to look at in the next version. The rewards too were purely extrinsic, and this was one of my biggest surprises, is that not everybody likes extrinsic rewards. Not everybody likes getting a Starbucks card or a yoga class or whatever that might be. Some people just like the inherent intrinsic reward of doing something good, or getting some sort of notification that makes them feel good with positive messaging and so forth. So that was another really big surprise that we learned. Also, that rewards aren't universally desirable. So what we found in different populations, people wanted different things. So we had to solve that problem as well. And then there was the other piece that it was kind of cumbersome to connect with your family and friends and your clinicians on the app. Because of HIPAA compliance, which obviously we have to take that into consideration, and all of the data privacy that we had to protect and look at, we couldn't just upload the person's phone book for them to add a person like you would on Facebook. And so we had to find a fun and easy way that people could still attach their community members onto the app, but ultimately make it so that we also still protected their privacy and we were HIPAA compliant. So we took all of those lessons and we did some true research this time. We brought on a data scientist, we brought on more designers that really did due process. They did everything from deep focus groups, and they looked at rewards in two different ways. They used the RAMP framework, and we also looked at core drivers within the recovery population specifically, which is very different than when you're looking at a broad population. There's a big concept in recovery that once you get sober that you help other people and you're of service, you're doing things for sharing your experiences and being honest and transparent. And so we thought, how could we translate into the digital space? And we also found that it was powerful to tell our story, but ultimately us at the company are not the average customer that's just getting fresh out of treatment. That is often years and years ago for a lot of us. And so we had to go back out and actually really spend some time with customers that were going to be the customers that get out of treatment after 28 days. While sharing our story was really important, and then figuring out how we can tie the data to the data dashboard even better to provide the right kinds of analytics back to the providers and the treatment centers. So this is the new version that's actually coming out in about 3 weeks. And we've done a lot of study and research on it. As you can see, it looks much more friendly and much more community-based. It gives people a feel that's gamified. And we use two methods. We use contingency management in digital space, but we also looked at the matrix that uses 64 different kinds of gamification methods. Now, one of the challenges is that we didn't want to gamify this app like you would with like Candy Crush or something like that. We didn't want people to switch addictions or trigger that core part of them that was ultimately unhealthy. And so what we did is we sort of picked out all of the gamification frameworks that are positive reinforcement versus negative reinforcement and only utilize those to build the new application. We've also signed up with a gift card provider, and so that there's a larger variety of rewards that people can obtain for the extrinsic rewards. And when we're looking at intrinsic rewards, we've added a lot of different features like Easter eggs and different kinds of surprises within the platform. And we also did the same for the data dashboard. So one of the biggest surprises to me when we did research and we actually sat with counselors, looked at their workflow, is that they actually didn't want a bunch of data every single day. Their workflow is really complicated. They're super busy all day. They have so much data that they're intaking that sometimes it's even hard to spend time with the patient and give them a holistic view of what they need to address. And so this was not my preferred way of building the UI, but ultimately that's what the customer wanted. They wanted really simple tiles, and they wanted to see who's at risk, who's below risk, but still needs some attention. And the other wonderful thing that we did in this release is that we built a patent-pending relapse risk score algorithm. So we actually utilize not just data points from behavior on the app, but we're able to plug into the electronic health records and look at historical data. What that means is that if somebody misses an activity on the application and they have a history of, let's say, co-occurring disorders, schizophrenia or bipolar, if they miss a 12-step meeting or that therapy session, their risk score will significantly be higher than somebody that doesn't have any history with any of those. And so that algorithm obviously works behind the decks, and you just get this sort of simple risk score up there that you can see. Then if you want to go into a patient's almost like chart, you can click into their name, and then you can see a deeper trend of how their risk score has changed over the week. So if you're seeing somebody once a week, or they're just going in for a quick check-in, you can also see exactly what they missed, and you can see the trends there. So as you can see, this looks starkly different from two perspectives in the first version. One, it looks more professional. It's much more of an enterprise product. But two, we really simplified it, and we sat down with the customer at a very deep level to make sure that we were delivering what they wanted. So our key takeaways is that even if you are the customer, what the customer wants is going to be very different. So do research and more research. And sometimes more data on the front end, depending who your key stakeholders are, maybe is not better. Really research the stakeholders' workflows, particularly if you're in healthcare, and you can build their trust, add value, and then really build analytics and reporting on the back end for the key stakeholders that really want that kind of reporting. For us at a treatment center, for example, the counselors don't necessarily need to see the analytics and reporting, but the owner does, because he or she has to go back and maintain their accreditation like CARF and Joint Commission. And then the other piece that's a key takeaway is that digital and monetary rewards have to be extrinsic and intrinsic to obtain the highest engagement possible. So just to give you guys an example, in our test phase, we saw a difference in 30% engagement when we added extrinsic rewards. It upped it by 30% on the application. We're seeing at some of our key centers right now 76% engagement in sustaining recovery in the first 6 months, which is a huge shift. And so we're super excited to release the new product about 3 weeks and see what the shift will be after this. And we're also hiring. So my contact information is up there. If anybody's interested in speaking with me more, I'll also stay here after the Q&A portion. Thank you so much.
Great. We're going to have about 15, 20 minutes of Q&A. So because we're recording this, I'm going to bring the microphone to you.
Can you tell us a little bit about the intrinsic rewards and like some of the gamification and some of the things that you saw that made a big difference? And yeah.
Totally. So a couple of the things is that they have to be instant after you've completed something. So we do things like a certain button will light up, or there's like a congratulatory message. We've also looked at positive messaging. One of the key things about getting into recovery is that it's obviously very mentally and emotionally strenuous, and oftentimes you have really low self-esteem when you're getting into early recovery. And so having any kind of positive messaging, we're also looking in our future roadmap to give people the ability that complete certain activities to give away based on points, pick a charity and we'll donate on their behalf. So anything that makes them feel good, makes them feel motivated, those are the type of intrinsic rewards. And really, if they complete all of their activities for the week, there's a huge Easter egg that comes up that says congratulations with a huge banner and explosion. So those are the types of intrinsic rewards that those types of people out of the population really appreciated and have tested as really wanting that as part of the app. So.
Yeah. So I'm just wondering, how do you determine a reward is working versus not working? What's the criteria or data you use to determine that?
Yeah, so when we first started in the first version, we tested without rewards, and we looked at engagement rates for the same treatment centers across 3 of them. And then when we added rewards for the same types of treatment centers or the same treatment centers for a different cohort, the engagement went dramatically up. And then in terms of rewards, our data scientist actually dug up research where it quantifies and under contingency management that this is the amount of rewards that has yielded the best results in terms of engagement on the digital platform. And one of the other things is timing. So in the first 90 days when recovery is really critical and you're really getting back into your life, back into routine, it's key to give those rewards at a much more rapid rate. And that's also looking at how the brain of somebody with substance use disorders works as well. There's the reward part of the brain that really gets triggered in a certain way, but again, we use positive reinforcement for that rather than negative reinforcement to appeal to that.
Hi. Do you do anything about community building or peer support groups?
So in the app, we thought about this very long and hard. So people can add people that they already know on the app, and they can look at each other's progress. They can even message each other and encourage each other to stay on track. We looked at opening it up. However, we want the focus of this application to be for sustained recovery versus just a straight up social app. There's also a lot of risks involved with opening up a social network with people that are in a vulnerable population. And so we have the community aspect in terms of the people that are already in their circle, that they're meeting at 12-step meetings or therapy sessions, but it's not an open social network.
One more question.
Mm-hmm.
How granular do you get when you determine location?
So it is, I always describe it this way because a lot of people in recovery smoke cigarettes. So you can still be about 25 feet out from the building and it'll still verify that you enter the geofence. Yeah.
You said earlier that the providers are the ones paying for like cell phones if people need that. Are they also paying for the extrinsic rewards? And if so, how did you get them to buy into that idea that they're paying for that?
Totally. So we charge per patient for 12 months for the subscription to the provider, and the rewards are baked in. So we, out of our price per patient per provider, all of the rewards are baked in, and we also take care of that service. And depending on the state, there's different restrictions for wellness rewards, and so we just look at it state by state, depending on what the restrictions are. But the value add is multiple for them. So one, they get to stay connected to their population 12 to 24 months, which yields outcomes data, but they can also stay connected to what they call their alumni, which is super important when you're looking at how they're able to build out and be able to give access to people to enter treatment. And so those are the two different ways that they're able to pay for just the patient per year, basically, at a flat rate. Not yet. So we've thought about what it would look like if we did a pass-through cost through the treatment centers if families wanted to invest more into rewards. But that's going to be quite tricky, so we haven't tackled that yet, and we're keeping it at everybody, no matter where they're at, what treatment center, gets the same value of rewards available per year.
So it's a really amazing, compelling proposition, and I'm curious, what does like 1 and 3 years look like for you, like in terms of the growth or the vision for what you want to achieve?
Totally. So one of the things that we're really excited about is we're starting to participate in RFPs for insurance companies, which will give us access to serve a much larger population. We also just started serving drug courts, and so expanding that channel at well. If you're not familiar with the drug court system, what happens is that if you go through drug court, they'll defer your charges if you go into treatment or sustained recovery. And usually they have to take paper slips to 12-step meetings and therapy sessions to get signed, and so we basically eliminate that for them. So I would say growing into those 3 channels, and then beyond that, there's a lot of other applications for this, eating disorders, sex addiction, other types of addictions. And then beyond that, we're also looking at developing a product that's not on the smartphone. That would be for screen and technology addiction recovery. There's actually a treatment center in Bothell that treats video gaming and screen and technology addiction. And so we want to build the same functions of our current product, but in a way that the smartphone wouldn't have to be utilized.
Yeah, I have a question regarding your MVP. How did you plan your MVP? How many users? What was the population that you choose for that?
Yeah, so the first thing I'll say about an MVP If you think you're ready, you've waited too long. So you have to get over the fear that you didn't build something good enough and you just got to get out there and test it. That's my philosophy. But what we did is I basically entered tons of pitch competitions, came to ton of events like this, and found an amazing co-founder who also he has quite a bit of a network. He's an incredible guy. And I was still working full time at an app development firm when I got out of treatment. And so I spent nights and weekends using Envision, which is a super easy tool to prototype anything that you have or imagine. And that was basically our pitch deck. And we got our first round of investment, and we utilized a couple contract developers, a designer, and then myself and our 2 co-founders to get this out the door as soon as possible. And then we used our network to find basically people to beta test for free. So especially in our space, not-for-profit treatment centers were happy to test this for free because it was innovative, it was revolutionary. They could go back to their donors and say, look, we're using technology, all kinds of value adds for them. And one thing that I'll say that I didn't do enough of is really sit at those test sites and really talk to people and get every kind of feedback that you can. I think when I'm looking at what I spent time on, investor relations, building the company, figuring out how to sell, I would have spent much more time at those test sites, just sitting there and hearing feedback and sitting in the background and hearing what's going on.
Thank you.
Any more questions?
So what happens if a patient is loving the app, but they just get their program is only 12 months or 24 months with the provider, and then there's that cliff?
Yeah, so we actually allow people to continue to use the app for free beyond that 12 months. And we're also looking at building a community that's probably going to be a web application for those that sort of graduate from the 12 months. And what we're looking at is building out a huge community for that, where they get access to curated content by wellness coaches, recovery coaches, and other thought leaders in the wellness and health space. So there's 2 things we're looking to do. One, continue to serve them, and they can utilize the app for free. If they want the more costly rewards, or they want to go back to the same level of rewards that they were getting before, they can pay for it themselves. And then we are looking at developing this web app community, because that's one of the number 1 things that I felt like was missing when I got out of treatment, is that, if I go home, I'm alone. But if I have this app, I'm connected to someone instantly, and I feel like I'm not alone anymore. And that was really important.
So one of the graphs you showed was the 100 to 10 to 2, and you guys are addressing the 10 to 2 in terms of those who get out of recovery and those who kind of stay sober. Are you guys considering addressing the 100 to 10 at all?
We are, and the way that we're going to be approaching that is partnering with companies that specifically are already integrated into EHRs, because truthfully, the first person that notices that someone needs help is the primary care physician or the emergency room. And I think that's how we can access those 100. And so I actually, in fact, had a call this morning with a company that's already integrated and plugged into all of the prescription medication drug database. And so they can actually identify with the primary care physician if someone has a risk score for overprescribing. And what they don't have is, what do they do after that? Where do they refer? So that would be one of the ways that we're going to address the 100 that were up there. And one of the methods is if they didn't come back from a relapse and they don't know anything about recovery, we're partnering with an organization called Facing Addiction. In my opinion, they're the best not-for-profit out there for substance use disorders. They do things at the policy level in rural areas and community building. And they've built a resource hub that's completely unbiased for resources based on geography. So that's how we're looking at addressing the people, not just the 100 that have really identified as having a substance use disorder, but those that are still questioning it. Yeah.
Great. These are great questions. Any other questions? Okay, Daniela is kind enough to stick around for a while, so if you'd like to follow up with her more one-on-one. But mostly I want to ask you and joining me for a big round of applause for Daniela. Thank you. SC sent Products That Counts notebook, so thank you very much for that.
Thank you so much.
Yeah, thank you. And I have just a few closing remarks as well as a chance for anyone to come up and do a shout out if you'd like. So just a few things for anyone who's attending tonight. If you'd like to attend another Products That Counts events, and we really hope that you do, you can use the discount code Seattle Friends, capital S, capital F, and I've tested it and it works, and it will give you 20% off. So next month on August 8th, we are lucky enough to have Ash, who will be coming and joining us and talking to us about his experience with Snap. Also, each one of you, except for those who have been enrolled through my email address in the back, you'll be getting an NPS score, the Net Promoter Score. We're just looking for honest feedback. For me, the best feedback you can give is the feedback in the free text box, because that's most actionable for me. So I really appreciate take the time to do that. And then I'd like to also, before we do shout-outs, I just want to make sure that you know that the Zillow recruiting team, if you'd like to raise your hands, are in back. We have the space for another 45 minutes. There's a lot of food to enjoy, people to get to know, and then especially the recruiting team in back. Just a quick show of hands. Who here is new to Seattle? Okay, that's pretty good. Last week we had 50-50, and if you're looking for a new position, you have Daniela's to speak to, and the Zillow team, which to speak to, and then representatives from a lot of other companies here, Glowforge and Particle and others, so thank you very much. And then does anyone want to do a shout out that's, hey, I'm a university student looking for a project here, I'm new to the area looking for a new position, just basic things or announcement about their organization, just something really rapid fire. I also have a notebook for you if you'd like to come up. That's cool, because there's a lot of great food and drink and people with him to speak tonight. So thank you again.